Good afternoon, viewers. We are live again from Sakra World Hospital, Bangalore. Today we have Dr. Sachin Kumar, Senior Consultant Pulmonology and Critical Care Medicine. Welcome to the session, sir.
Thank you.
So today we are here to talk about the chronic lung diseases. Would you like to highlight, sir, about the topic?
So, for the benefit of viewers, this chronic lung disease is a group of disorder actually, and you will be surprised to know that as a group, chronic lung disease are the third mode leading cause of death worldwide currently, and every decade there is a tripling in the cause of death because of these diseases. So they deserve a good introspection in our medical science as where are we going forward to manage these cases in future, because these have a widespread implication in normal socio-economic and also health of our world population in general, because these diseases mostly are non-communicable and the incidence is increasing. So hopefully we'll try to take some questions from the viewers.
Yes, sir.
As we take it forward.
Okay, sir. So to start with the questions, sir, we have first question: what are the lung diseases, sir?
Yeah. So probably you meant to say what are the chronic lung diseases.
Yes.
So basically, as I told you, these are a group of disorders which are the prevalence and incidence, means what we say that the symptoms start quite long back. In the patient's terminology, it is like months to years.
Okay.
So these are the group of diseases which are there for months to years, and many times it is lifelong also. And this group comprises of the diseases which affect the lung air pipe, what we say, the wind pipes, which are the chronic obstructive pulmonary disease and emphysema, which is mostly related to smoking. Then other diseases are like lung per se is affected. So there are interstitial lung diseases, then patient with sleep apnea and pulmonary artery hypertension. So these all are clubbed together as chronic respiratory diseases. So these are the different types of chronic respiratory disease which are commonly seen in nature.
Okay, sir. So, sir, generally, how do they become chronic, sir? What would the reason, sir?
So, as we see, there are two types of major types of things which we consider in chronic lung diseases. One is that by nature, some of these diseases, once they happen, they are there for life. And this holds true for some diseases like your birth defects or lung problems starting from birth, or certain types of interstitial lung disease. The lung become fibrosed or hard, the scarring of lung, which many times are without any cause. So they are, once they come, then they are continuing the damage to the lung and respiratory system is there for entire life. That is one group of disorder. The second is that patient is sensitive, but most likely environmental factors. So probably pollution, smoking, as in COPD, that chronic obstructive pulmonary disease, and bronchiectasis, that is another disease of your lung pipes. In the lung pipes, it becomes damaged. So in these cases, you have acquired causes. Means you are genetically predisposed, but on the top of that there are certain things which are environmental in origin, like repeated chest infection, like tuberculosis in India, that leaves lung scarring, then pollution, then also occupational exposure, somebody who is working in mines, sand mines, or occupational exposure to something like asbestos. These things also will cause you chronic lung damage. So in general there are these two causes of chronic lung diseases, which can be a primary factor in these cases.
Okay, sir. And sir, what are the causes generally, for this kind of chronic lung disease?
So generally, once we figure out when the patient walks into the clinic and he has a long history, then we try to find in history whether there is some genetic cause, because family history is very important in those cases. Some patients will have, like in their forefather also suffering from the same pattern of disease. That is one thing. Second thing, any significant exposure to pollution or smoking. That is another good pointer toward a cause of COPD. And third thing would be any history of any recurrent infections like tuberculosis in our history, and in certain cases autoimmune diseases. There are certain panels in blood investigation which you do which are autoimmune in origin. Means your body is acting against your own. So they form an antibody which damages your lung organ. So generally these are the causes generally of chronic lung diseases. And basically many times these are missed. That is why initially maybe they would have gone to a doctor or to some other facility, they have given symptomatic treatment, and the cause was never identified. That is the probably reason why they end up having a chronic lung disease also, because of misdiagnosis, because many of these diseases will have similar symptoms. Like all of these problems will have some sort of breathing discomfort, cough, and all those things. It depends on the treating doctor to do a Sherlock Holmes like analysis to reach to the conclusion what is the cause of this disease, and then we reach to a conclusion.
Okay, sir. As you said, that causes are difficult to find out.
Yes.
So generally, we wanted to know, sir, our viewers, what would be the symptoms or
Yes.
basic symptoms.
So generally, as I told, as a group, they will present with long-term history. Long-term means months to years, and many times these are progressive symptoms. That initially patient had mild problem when he is walking or upstairs or walking fast, then only breathing discomfort is there. But slowly, it is affecting his daily activities of life. So he might become so breathless that going to toilet or changing clothes also he feel breathing trouble, and also the cough. So main symptoms would be a progressive development of breathlessness and also cough, some sort of cough, and sometimes there is chest pain, and in some cases you can get some sputum production along with some blood in the sputum also in some cases, and probably these are more commonly seen in patients with COPD, bronchiectasis, or these things. And then as I told you, there is one more important chronic lung disease. It's a respiratory disease, not probably a chronic lung disease, but sleep apnea, which affects your upper airways. Patient will have long-term history of snoring and daytime sleepiness. That is also one form of chronic respiratory disease which needs attention right now. So probably these are the common symptoms with which they will walk into our clinic.
Certainly, these symptoms are very difficult to tackle in the normal life. So, sir, how these symptoms can be prevented?
Yeah. So basically, as you see, right now we are in an era of medicine where the focus is not only treatment, but prevention is also a part of the activity. So probably whenever we see a patient with chronic lung disease, first of all, our endeavor is to find the cause. And once the cause is identified, we try to eliminate that cause as far as possible. Suppose somebody is exposed to occupational history of asbestos exposure, obviously we'll tell them to get rid of this exposure, or pigeon exposure is also linked to many types of lung fibrosis, that is known as hypersensitive pneumonitis. So these things we take in the history and try to eliminate, like smoking. So health education, we educate the person that with this exposure it is incremental damage to your lungs, so be away with these things. Then the second subset is to do some sort of like vaccination, like we do influenza and pneumonia vaccination, and probably right now context COVID vaccination also, to prevent any further damage, because any infection with these type of chronic lung disease patient will not be tolerating in a good way. So they will suffer if they have this type of pneumonia because of these infections. So vaccination, adult vaccination of influenza, pneumococcal and COVID vaccination, they are very important pillars of prevention. And third thing is that once they are diagnosed also, we take through them, apart from medicine, some pulmonary rehabilitation exercises protocol they are put with that, and we run here very successfully the pulmonary rehabilitation program, and that takes care of chronic respiratory disease. They teach them certain exercises from the yoga point of view also, and from our physiotherapy point of view also, which makes the lung overall the lung health more good and efficiently utilize the lung respiratory system.
Okay, sir. So, sir, how we can diagnose
Yes.
in this at early stage or any other stage?
Yeah.
How we can diagnose?
So probably the most important milestone is to reach to a correct person. By correct person means correct specialist, because as I told you, this group of disorders have very common symptoms, and initially they are misdiagnosed many times and only asthma. So the patient are unnecessarily put on inhalers and even steroid for that matters. So it is very important that they should, once you have a chronic respiratory disease, seek a advice from an expert which is well versed with your chronic respiratory disease. And second is that the history taking is very important. As I told you, many things are there in the history. No test will tell you that this asbestos is the cause. So the history taking should be diligent, and it's like a Sherlock Holmes. As I told you, we need to find out what we think the cause could be. So it's a pinpoint questionnaire which we give to chronic respiratory disease, that these are the things which we need to know from you. And obviously we find the cause, and third would be a panel of battery of tests, which are blood tests probably for to rule out any infection or autoimmune disorders. And also we do a lung function analysis for them to see evaluate what is the condition of respiratory system, how efficient they are working. So there are various type of modalities of various tests, and sometimes we do lung biopsies also by doing some interventional pulmonology procedures like bronchoscopy or transthoracic lung biopsy. So we take out a piece of lungs and see whether what is the etiology behind that. So these are the different things. Basically it's a staircase approach. We go from a history taking to non-invasive to invasive modality, and then once we satisfy ourselves that we have reached to a conclusion, then we target that type of disease.
Okay, sir. So how you have clearly defined that how we can diagnose, and now we wanted to know about the treatment, how we can go about it.
So the broadly speaking, chronic respiratory disease as a group, the treatment can be divided into medical and non-medical. So it's not only medical, because I told you this has very social, economical and other implication also. So medically there are medications obviously. Then second group of medicine would be vaccination for prevention of any infection. Then third is there are certain new types of biological agents. By biological agents we mean to say there are some antibodies or monoclonal antibodies or receptor antibodies which are targeted treatment. And these are mostly used in patients with autoimmune disease. So these are sort of immunosuppressants, but they are used in a set of patients. So these are the medical line of management. And obviously non-medical line of managements are in a holistic sense. One is a pulmonary rehabilitation, that exercise protocol, which includes a consultation with not only a physiotherapist, but also a psychological counselor, because these chronic respiratory disease are long-term disease. And many patients are depressed, are anxious, what's going on, even the caregivers are anxious. So a psychological counseling, the nutritional support, because many of them are malnourished, because the cough and sputum production, they are spitting out the proteins out of the body. So they are inherently malnourished. So the nutritional counseling is there. And then also we have a social support system, because these in Indian setup, when the patients are paying out of their pocket, the expense over healthcare of such type of chronic respiratory disease is too much. So that is why that social support system is also there to support them financially and socially also, because if there is no caregivers, then social workers comes to play the role, because the patient has to live the life with this type of disease most of the time. And also there are certain types of treatment like oxygen. Some of them will require oxygen support also. So then they will require oxygen supplemental to be used at home also. So these are the types of treatment we offer them.
Okay, sir. As you said that it's a prolonged, disease and patient have to live. So, sir, generally we would like to know, sir, how treatment takes to shows that how much time treatment shows.
So generally, once we diagnose the patient, then generally it is 2 to 3 months is the initial intensive phase. We try to optimize the treatment protocol for initial 3 months to make sure that whatever we could have reversed, we have reversed, because chronic respiratory disease will have two components. One would be a reversible component. The second would be preventive component, means we will try to stop the progression of the disease. So first 3 months is the reversible part. We try with all the medication, exercise, everything to gain whatever is lost if we can. Then the second part of treatment will continue to slow down the progression of the disease or to prevent further complication. And probably these things go on for life also. Because as I told you, most of these diseases are long term, and some of them the definitive treatment will be a lung transplantation. Some sort of like COPD, bronchiectasis or interstitial lung disease, where all treatment modalities we have already given, patient has gone through all treatment, still patient is not getting so much improved, and he has gone to a limit where the conventional medical line of treatment is failing. Then that is the time when we start thinking, and we probably refer them to a lung transplant center, so that because this is the definitive treatment in many of your chronic lung diseases which otherwise cannot be treated.
Okay. So sir, is there any side effect associated with this treatment?
So obviously whenever we take into consideration of a disease which is there for life, some of the medications are also being used for life. So obviously there are certain side effects of some of the medicines, not always, but it depends on person to person, number one. Second thing, all of them require follow-up. This is especially true in patients with certain type of group of disease, of patients which are like interstitial lung disease or lung fibrosis, in which many times we use immunosuppressants, which are like steroid or other medications, which might decrease their immunity. So there is a risk of exacerbation of infections and also other side effects. But what I can assure you, with regular follow-up and regular surveillance, because always the patients are being tracked, monitored for these side effects, and these are easily manageable, and most of them are reversible. Suppose the patient is not tolerating one group of medicine, then we'll change to other group of medicine. So if the patient is in follow-up and we are actively looking for the side effects, then hopefully these side effects are not so much as the original disease. So we always weigh the benefit is to risk ratio. So whether continuing this particular medicine has benefit versus the risk, what is the side effect is there. So, and we try to optimize that and minimize the risk. That is how we proceed, and always we track the patient for these side effects.
Okay, sir. So thanks a lot, sir. With this, we would wanted to conclude the session. Thanks you, sir, for joining. And sir, we would also, for our viewers, if you have any questions, you can, drop the on the comment section any of your questions, and our expert will definitely, answer those questions. Thank you again, viewers. Thanks.
Thank you.
Thanks.
Thank you.